Hello everybody, and today I want to talk to you particularly about Vantelin Gel and why is this gel so special. Okay, why is this gel so special? Of course, we also have a brochure that we can take a look at, and we'll take a look at the diagrams in the brochure and try to explain what they mean. So this is not a normal topical analgesic. Of course, you can use it as a topical analgesic, but the quality, the main property of this item is that it is an anti-inflammatory, non-steroidal anti-inflammatory drug that is very strong, very powerful. So what you want to do is if you just applied a small drop of it on your finger, and you rubbed it on an area that has chronic pain. Now here's the thing, we do know from modern research that acute inflammation within the first 2-3 days can actually be good for you because it will stimulate your body to heal itself more strongly. It becomes stronger. But say you have inflammation beyond 3 days. Some of you have inflammation or pain beyond 3 weeks. In that kind of condition where you have a cycle of inflammation, the body would have trouble healing itself because of the constant inflamed condition of the injured part of your body. So if you're experiencing chronic pain in a certain part of your body, whether it's your lower back or your shoulder or your knee or your neck, even your mid and upper back, you can apply the Vantelin Gel because the drug, non-steroidal drug, that is anti-inflammatory, will reduce the inflammation in that area of your body, thus giving your body a chance to heal itself. As mentioned, this is not a normal topical analgesic. Normal topical analgesics make use of salicylates to irritate the skin. It's really a form of distraction from the underlying pain, the underlying cause of the pain. So you create another irritation or pain on the surface of the skin, and this distracts you from that pain that is deeper in the tissue, in the deep tissue. So imagine if you've had chronic pain, say for a year or two. Some of you might have had chronic pain for 10 to 20 years, and you keep applying topical analgesics that are just masking the issue, masking the pain beneath. Do you think your body will get any better on its own? I think the answer is fairly obvious. What you need to do is to get rid of the inflammation that is causing the chronic pain, and then your body will have at least a chance to heal itself. Of course, we don't know what is the cause, and as I've always told customers who come and take a look and try, and if you haven't tried this and you want to try it out first, do visit me at the store that I specify in my Facebook page. At the moment, I am at Compass 1, Watson's, between 12 noon and 8 p.m. every Saturday and Sunday, but I could move to a different store, and so you need to pay attention to the information provided on my Facebook posts. So what this does is it uses a non-steroidal drug called diclofenac. So diclofenac, and what that does is that it inhibits the production of prostaglandins. Why inhibit the production of prostaglandins, or what does that do? Prostaglandins are what produce inflammation and pain, chronic pain. So if you inhibit the production of prostaglandins, the inflammation would be reduced. And when that inflammation is reduced, that has been hampering your body from healing itself, your body now has a chance to heal itself. So, unlike topical analgesics that are just providers of temporary relief, what anti-inflammatory drugs, now non-steroidal drugs, and I mention non-steroidal because that means it has no side effects, but for a anti-inflammatory drug such as diclofenac, in this case diclofenac sodium, which is longer lasting than its counterpart diclofenac diethylamine that is in the ingredients in Japan where you find this. Now you will note that all of our products, at least those that I sell at Watson's in Compass One, are made in Japan except for the Vantelin Gel because we have special permission to manufacture it in Malaysia using diclofenac sodium. Diclofenac sodium is a stronger version of diclofenac diethylamine and more long lasting. So you actually can buy this, from my knowledge, only in Singapore, maybe in Malaysia as well, but the Japanese version, if you are in Japan, you're most likely going to get diclofenac diethylamine. In any case, this is the longer lasting version, and from my understanding, diclofenac sodium in Vantelin Gel is at least equal, if not stronger, than the ibuprofen and the diclofenac diethylamine that is used in Voltaren. So come and try it if you want to try it. I'll give you a drop on your finger, you rub it on your neck, on your arm, on your knee, on your leg, and see for yourself its effects. If you trust me and I tell you that more than 100 people have bought, or at least I've sold more than 100 pieces within just a few days, you can actually order it as with the rest of the Vantelin supports and sleeves, compression sleeves. You can order this by sending me a pay now amount. Right now, the 45 gram tube, the original price is $25 Sing dollars, and right now it's $20. So find out from me the updated price either by WhatsApp or write a post on my Facebook page, which is public. All the information is public on my Facebook page, and I will try to respond to you within 1.5 to 2 days max. So if you pay now me the amount, and it is $40 and above, I'll get Watson's Compass One to actually send it to you without any extra delivery charge to your address. Of course, I'll need your exact address and your full name. If it is under $40, your total, then you just have to pay an extra 5 Singaporean dollars for the delivery fee. So the 45 gram gel is more worthwhile because, or rather it's more, it's cheaper in the long run, it's less expensive because it's more cost effective because it is 45 grams and it's $20 for one tube. So if you buy 2 tubes, for example, it's just $40. If you bought the 20 gram, there's less gel in there for $13, and after discount $10. Could be $10.40 actually. $10.40. I think it's $10.40. Yep. So what will happen is that in the long run, if you're using more of it, you would want to get the bigger one. But if you do just want to try out a smaller version of the tube, then indicate to me you want a $20 version and pay me $10.40, but with an extra $5 charge, unless you are also purchasing other Vantelin supports from me that will total more than $40 or $40 at least, and will deliver it to your doorstep within 3 working days. So that's Vantelin Gel for you. It is highly effective because when it reduces inflammation, your body has a chance to heal itself. So not just a topical analgesic that just masks the deeper pain. This actually reduces inflammation in the area you rub it on and give you a chance your body a chance to heal itself. Talking about shoulder injuries, if you're suffering from shoulder sprain, you can rub it in the area where you're experiencing the pain, very commonly in the anterior shoulder, sometimes on the side, if it is a deltoid or even a supraspinatus problem, okay, and we can go more detailed into that because this is a good chance if you have frozen shoulder, which is encapsulitis of the shoulder, which is inflammation in the joint capsule of the shoulder. You can actually use this, but most people will feel a pain on the outside and they won't apply it in the correct place. So I'm going to show you now, if you have a true frozen shoulder as opposed to a sprained shoulder, how to apply this. So what you want to do is put a drop of this on your finger. You're going to apply to 4 different places. One is the anterior shoulder, where it normally hurts. Now bear in mind that if it is a shoulder sprain, let's say you played badminton and you smashed, that kind of injury normally will be located at the infraspinatus, the shoulder blade, okay, the infraspinatus. And the infraspinatus goes to the side of the shoulder and attaches to the anterior side of the humerus, of the proximal humerus, the anterior side, anterior proximal humerus, because it does this motion. It does external rotation or lateral rotation. And the reason you injured it is because the infraspinatus is easily injured through explosive movements that stretch it. So in other words, if you're doing a smash, you're overly stretching the infraspinatus explosively. Okay, so if it is under some amount of tension and then you're smashing, you could injure the infraspinatus. So explosive movements in internal rotation or medial rotation tend to injure the infraspinatus. So you would want to apply where the point of contact, where there's pain. You want to apply all the way, the entire shoulder blade, okay? However, if you have a true frozen shoulder, in other words, how do you determine that? You can't lift your arm anteriorly beyond a certain point. It's excruciating. You can't do it to the side. You can't do this, okay? With the palm up, it's painful when you do this. You can't go all the way up and touch your ear as a normal person should be able to. And you can't put your back, you can't place your hand like this diagonally towards the opposite side of your hip, of your body. So if you pull, or if it's this shoulder, then this way. So not just across, but diagonally towards the ground. If you can't do all those movements, then you're likely suffering from a frozen shoulder, especially if you're talking about after 3 weeks. If it is a sprained shoulder, after 3 weeks you're going to see some improvement, but a frozen shoulder is going to take 18 months. It's basically an inflammation of the joint capsule. So you're going to apply here, you're going to apply right here where the deltoid is, so supraspinatus and deltoid tendons, and you're going to apply infraspinatus, all right, as we mentioned earlier. But the most important point is the joint capsule, and that can only be located underneath in the armpit. So put some gel, put some Vantelin gel on your fingers or on your thumb and go deep into your armpit and massage the gel into the armpit. Massage the gel deeply into the armpit. You can use Vantelin gel up to 4 times a day because it's a strong non-steroidal drug, and no more than 4 times a day, okay? So try that if you have a true frozen shoulder to at least reduce some of the inflammation that is in the joint capsule. If you have a normal sprained shoulder, then just apply. Okay, normal sprained shoulder, even if you had it in infraspinatus shoulder blade, rub your shoulder blade with the gel. If you have it in front, rub it in front. If you have it at the side, rub it at the side. If it is a supraspinatus issue, you can rub deeply underneath the trapezius. Trapezius is this big piece of muscle there, right? This big piece of muscle that slopes up to your neck. But deep to that, underneath that, is where the supraspinatus runs, and that's good for moving the arm at least the first 15 degrees from neutral position. So from this position, the first 15 degrees, you're gonna have the supraspinatus lifting, and the rest of it mostly the deltoid. So if you apply the gel there, if it is a supraspinatus problem, then that will help to reduce inflammation at the area of the supraspinatus. Okay? So wherever you have pain, you can rub it. But as mentioned, okay, so if it's a sprained shoulder, it can also be the subscapularis, for example, teres major. And that's also underneath the armpit. So not just the joint capsule, you have the subscapularis and the teres major going and attaching to the anterior shoulder as well. So you could also have pain in the anterior shoulder, but it could be coming from underneath the armpit. And of course, we know the subscapularis is on the anterior side of the shoulder blade, okay, not the posterior side as the infraspinatus, teres major, minor are. The subscapularis are on the anterior side, that means the front side of the shoulder blade, so it's very hard to reach. And it's underneath, it comes up from underneath the armpit, all right, and it attaches on the anterior shoulder. What it does is this motion. So if you are, in this case, notice we talked about the badminton smash, right? It was also this motion, but that was an explosive motion. If you're talking about a slow motion, repetitive, it could be caused by swimming. Swimming is one of the sports where you have to pull with your subscapularis. You have to pull with your subscapularis. And that can cause subscapularis strain or strain. Subscapularis strain. So a sprain is where a ligament is slightly torn. In this case, muscles, we use the terms strain. So if you're doing a lot of, whether it's butterfly stroke or you're using front crawl, by the way, I had a competitive world-class swimmer correct me, and I see the same mistake used, well, that's being a little bit harsh, but so-called mistake used by other, even elite coaches. So this is not freestyle, it's front crawl, because freestyle actually means you can use any technique you want, but let's not split hairs here, okay? So the front crawl, I'm just trying to show off the little bit of information I learned from an elite swimmer, because I'm not a swimmer myself. So this is the front crawl, and it uses a lot of the subscapularis, as does the butterfly stroke. Okay, butterfly stroke also uses a lot of medial or internal rotation to propel yourself. So that uses a lot of subscapularis as well, and subscapularis can be injured from that. Those movements are not as explosive. If you're a competitive swimmer, you might say, hey, come on, that's very explosive. But not the same as a badminton smash. Okay, so you would want to consider the subscapularis, treating it if you're having anterior pain and you know it's caused by this pulling movement. It can also be caused, of course, from arm wrestling, right? Because the arm wrestling, you have a lot of internal rotation as well. Yes, I do know you need to use your body weight, etc., and proper technique, but a lot of subscapularis, a lot of internal rotation. Therefore, treat the subscapularis if you were injured through arm wrestling. How to do that? Again, put some gel onto your thumb or onto your fingers and massage deep into the armpit, if possible, the front side, the anterior side of the shoulder blade. Very difficult. Please refrain from injuring yourself. These are some home remedies that you can do using the Vantelin gel. And of course, for the knee, wherever your knee pain may be, if it is on the anterior side, if it is patella tendonitis, jumper's knee, whatever knee pain you have, apply that, rub it there using some force. Of course, don't injure yourself again. If you're already feeling a lot of pain, make sure you moderate your pain. If it is on the medial knee on the inside, then rub it on the inside, okay? It can be joint capsule, it can be the meniscus. If it is on the lateral side, lateral meniscus, you can massage that in between the joint. You can massage the meniscus. You can also massage the lateral joint capsule. You can dig deep inside there as well. If it is on the top part, the distal part of your thigh, you can massage the quad tendon. These are the quadriceps. You have the vastus lateralis, vastus medialis. You have the rectus femoris that comes up across the hip joint. But underneath the rectus femoris, you have the vastus intermedius. They all join into a tendon called the quadriceps tendon, the quad tendon, that goes underneath the kneecap and re-emerges as the patella tendon, the kneecap tendon. So they're one and the same, but the quad tendon you can massage here as well. Of course, anywhere on the quads you can massage if they're tight. If they're tight, they could be caused by inflammation, and you can massage deeply into them. If you don't want to use too much of the gel for practice, you can use water. Use water and start rubbing first superficially, which means lightly, and then more and more deeply. Okay, for those of you who have learned massage, you're a qualified, certified massage therapist, you know what I'm talking about, yeah? And of course, preferably towards the heart. I'm doing it this way because it's difficult to massage backwards, which is why you have massage therapists doing it for you, because it's very hard to self-treat. But if you're using the gel, you can rub on the quadriceps, okay? Various parts of the quadriceps. If you have ITB, iliotibial band, which is a band that is joined by the tension fascia lata and the glutes, and they form this band down and they attach on the fibula, the small bone of the lower leg. That can also cause knee pain, even medially. If you have tight IT band, they can pull your fibula laterally, causing knee pain medially. So you can have knee pain medially when the IT band pulls the knee laterally, causing medial knee pain. Okay? So you can have that as well. So you can massage the IT band with Vantelin gel. You can massage the part it attaches on the fibula, the lower leg, and you can also massage the medial knee where you feel the pain. Okay? So, of course, the vastus medialis you can massage as well using Vantelin gel if you think that's a cause of the issue. But on the knee itself, you can massage Vantelin gel in it because it will reduce inflammation, giving your body a chance to heal. Now, there's so much. This is such an interesting topic. I'm not just rattling off. This is a topic I've been interested in for decades, which is why I'm able to provide you with such information. If you actually come to the store and visit with me, we can actually do various tests, muscle tests, squats, watch you squat, and see how your knee is affected to find out what may be causing that knee pain. But once again, there are multiple factors. It could be immobility in the ankles, immobility in the hips, causing the knee to over-mobilize when it should be stable. Remember that, again, alternating joint function theory. So you have mobile ankle joint. It's supposed to be mobile. A mobile knee, a stable knee joint, and a mobile hip joint. So they're alternating in function. But if the ankle joint becomes fixed because of injury, then the knee joint will be forced to compensate by twisting, torsion, and then you're going to damage the knee joint, especially the meniscus, and possibly even the ACL. So the hip joint, similarly. So in an upcoming video, I'm going to demonstrate hip mobilization exercises, okay, and how to increase the hip strength in various extreme ranges of motion that together, all together form what we call mobility in the hip, create mobility in the hip. So when you mobilize the hip and the ankle, the knee stays healthily stable, especially if you strengthen the knee through knee strengthening exercises. So again, the reason I brought this up is because knee pain can be caused by a variety of issues. Of course, the cartilage could have degenerated, the meniscus could be torn, the anterior cruciate ligament, the ACL, could be torn, the PCL could be torn, the lateral collateral ligaments, lateral collateral ligament could be loose or a little bit injured, torn. Similarly, with the medial collateral ligament, that can also be injured. So you can massage those, but there's no guarantee it's going to fix your problem because there are multiple causes. For example, even if you fixed it, if your ankle remains immobile and your hip remains immobile, or one of those, then the knee will be forced to twist again and will be re-injured. It's as simple as that. So we need to look at it as a sequential diagnostic procedure. You need to eliminate, unless you do a proper muscle test and watch what creates pain, and then you can kind of pinpoint what's actually creating the pain. Otherwise, the conclusion will always be some sort of degenerative disease, such as cartilage wear and tear, damage, meniscus tear. You know, it could be actually any one of these numerous possible causes. So meanwhile, while you are trying to diagnose what is the cause of your knee pain, you can just apply Vantelin Gel in those areas where you feel pain. Put on the knee support that stabilizes the knee, lifts up the knee. If you watch that video on how to put on a Vantelin knee support, even in the episode on why use Vantelin knee and ankle supports and compression calf sleeves, I revisit that, teaching you how to put on that support in order to lift up the kneecap to provide better blood circulation underneath while stabilizing the knee from torsion and allowing full range of motion in flexion extension. Please watch that episode if you haven't, and if you have knee pain, because if you wear that knee support, that also gives your body a chance to heal the knee. But first, reduce the inflammation by applying Vantelin Gel on your knee. Thank you so much for watching. You can also apply Vantelin Gel on your wrist, your elbow, anywhere else in your body, your lower back. So Vantelin knee gel as an anti-inflammatory gel can be used on muscles, soft tissues, and on joints like the knee joint, the elbow joint, the shoulder joint. But it can also be used on muscles such as the lower back, the trapezius muscle, your forearm. One gel multi-pain relief. You can apply anywhere, just don't get it into your mouth or your eyes. And the last word of caution, diclofenac sodium is very strong, so do not refrain from applying this on children under 12 and on pregnant women, because pregnant women, the fetus in a pregnant woman has an extra blood vessel, an extra artery called the arteriosus. Let me try and spell it for you. Arteriosus. Okay, Arteriosus. arteriosus, arteriosus, that joins the aorta, the main blood vessels that pumps blood around the body, joins the aorta to the pulmonary artery. So only a fetus has that. When the fetus is born, that is closed, and diclofenac sodium can cause premature closing of the arteriosus, that artery, in the fetus. So just refrain from using Vantelin gel on children under the age of 12 and on pregnant women. Otherwise, you're good to go. Just try and give me the feedback of your trying. Order a few of these tubes from me and see how it goes. All right. Most of the time, you will find that it is highly effective. You can either come to the store, look for me, or you can order it from me right here. Send me a WhatsApp message. Pay now me the amount, $10.40 per 45 gram. This is a 20 gram tube, by the way. So it's $20 for the 45 gram tube, $10.40 for the 20 gram tube. So if you reach $40, 40 Singaporean dollars, the delivery to your home address will be free. You can have it delivered anywhere, actually, to someone else's address or to your office as well. So leave me a feedback at the bottom, and post some comments on the Facebook page where I will share this video as well. Thank you very much. This is Zhi Wei Lim. Hope to see you again soon.